everyone, my name's Helen. Welcome to the Shrimpy McGee channel. Thanks so much for joining me here. You know, over the weekend I was seeing so much stuff, mostly on Twitter, but also on the news about the coronavirus. And then I spotted this selfie from Gwyneth Paltrow on her Instagram, and I didn't think I had anything to say about this, but apparently I do. I had lots of thoughts and feelings about this, and especially what is wrong with this picture. So I wrote about it on Instagram. I put a post up, and so I will link you guys to that post if you want to look what I wrote there, which is probably going to be sort of similar to what I'm saying here. But I do have something to say, and I'm actually had more expertise than I thought I did. And here's why. So here's a bit of a story time. If you want to just see me talk about the Gwyneth Paltrow photo, I will put that more towards the end. But for now on, here's how I know what I know and how I found out about this, which is that you know, I worked during the SARS crisis in Toronto. That was 17 years ago today. Toronto, if you don't remember, was hit really, really hard by SARS. We had over 400 cases, which actually seems kind of low now considering the coronavirus, the novel coronavirus numbers. SARS is actually also a type of coronavirus. Coronavirus is just a sort of umbrella term to talk about a specific shape of virus. But SARS was it hit us really, really bad. It really hit healthcare workers really bad. We had over 40 deaths. It was scary. It was a time of crisis, definitely, and it just got out of control in Toronto. I was hired at the time to work the front desk of a rehabilitation hospital that is still around. It's called Bridgepoint Rehabilitation Hospital here in Toronto's sort of East End. And I worked there during the end of this SARS crisis. It wasn't the middle of it or when, you know, fresh new cases were still going on, but it was still in the city. And so I worked at a rehab hospital, which is different from a regular hospital because in a regular hospital, there are like varying degrees of sick people. You have really, really sick people, and you have people that have had a baby that are not necessarily sick, but they've had a baby, or people that are just going in because their specialist works there and they're getting their eyes checked out, or because they're just getting a few stitches and they're going to go back to regular life soon. That is not the case with the rehabilitation hospital. Many of them were there maybe for life or until they got better, but there were a lot of heartbreaking things to see there. And it was an amazing job in that I was still very young at the time. I was still in my early 20s, and it just taught me like how precious life is. You know, there was an RCMP officer who is a quadriplegic, and there was a woman who had West Nile virus and was now paralyzed, and just all kinds of incredible people with just such an incredible sort of fortitude and life force. And it taught me a lot of lessons. And that could be a whole other story time just about the amazing people that I met there. And it was a stressful job, definitely. But you know what was crazy about this job was that, and good, I suppose, looking back, was that I had to wear one of those N90 respirators. So that's a face mask covering thing. I had an eye mask, I had gloves, I had the full protective gear. I don't think my hair was covered. I'm just trying to remember back. I didn't take any pictures of myself, unfortunately, in full gear. That would have been cool to look back at, sort of. But I just wanted to sort of talk about wearing a face mask respirator style thing and sort of some of the misconceptions that we're seeing, and even what Gwyneth Paltrow has put up. Why, to me, that was concerning as soon as I saw it. When I was working at Bridgepoint Hospital, before I did the job at all, I had to meet with somebody who was a professional respirator fitter. This is an actual job. So you can't just like pick up any mask. This is like a surgical mask that I did legit pick up last time I was in the hospital. You don't just pick up any mask and put this on and think that that's gonna do the case. Like, there is actually someone who fits you for it, because not all masks will fit you the same. So I don't have those different masks to try and show you. Obviously, it's been years. But one thing I remember is, oh my gosh, they're super uncomfortable. They're very, very tight to your face. And as I recall, the test for whether it fits well or not was that you would do the testing under the supervision of this respirator fitter. And if I recall correctly, she had me under something that you would put one on, and she would also teach you the steps of putting it on, you know, properly. You know, there's like steps about washing your hands and how you put it on and how you put it off. I am not going to go through all of these right now in this video, but I will link you down below to a reputable link from the World Health Organization about putting masks on and taking them off. So if you're here for that, have a look below. I'll put that in the links. But when she put the mask on, she sprayed something and it tasted like saccharin, like just super, super sweet. You could taste it right away. It was not so, and so you'd wear the mask, she'd spray it, and you'd have to tell her whether you could taste that or not, as I recall. And let me tell you, I could taste it. I could taste it in 2 out of the 3 like respirators, because there were 3 different types that we tried, and it was like only on the 3rd one that I got a good fit. Isn't that wild? That's how they get tested. Like there is an actual test. So you don't know, like you could be buying all these different respirators and thinking that they're gonna work perfectly, and they may not because you haven't been professionally tested for them. So that's just one point that I wanted to bring up, that this is something that someone does as a job. They test people for this stuff. The other thing that I wanted to point out that I think people maybe don't know is like, they're not comfortable to wear. This is a surgical mask. And by the way, if you have one of these, you know, the yellow side, the color, if you have blue, the blue, so the color side always goes out with a surgical mask. And so you put this on, right? So here we go, you're supposed to form this to your nose, right? Your hands are supposed to be clean, but I will tell you right now, there's all kinds of gaps in here. This is not gonna protect you the way one of those N90 or N95 masks are going to. In my mind, this is more for like if you need to sneeze, this will catch your sneezes and stuff like that. So if you're the one sick, and I got this at the hospital, I was visiting the hospital and they give these out. So if you're like sneezy or something like this, you put this on to catch your sneezes. It's not really to prevent other people's viruses from getting into your face, but I do see people wearing them. And let me tell you, I took 4 flights this last month, and the craziness I saw with people and their face masks, the way that they were using them incorrectly just honestly shocked me. Like there was literally no point in putting on a face mask, okay, if you're gonna just like put it on and then like just touch the front of it where all the germs went and take it off again. Or like people would like pull it down, talk to somebody and put it back up. Like that's not how a face mask is supposed to be used. Like once your hands are clean and you put it on properly, you're not supposed to touch it or take it off. You leave that on, and let me tell you, after 8 hours of a shift, our faces back at the hospital were like so indented. We had these terrible, crazy indent marks in our face because they fit so tightly. And when I tell you you can't take them off, I really mean it. Like I did not know what the other people I worked with actually looked like. Isn't that funny? Like there was no way I would recognize them in the parking lot because they had these masks. We really could just see each other's eyes through things, through like, we also had goggles on as well. So there were people I was actually surprised to see what they look like when they took all that stuff off. So that's another funny anecdote. So yeah, so that is sort of some of my experience there. It was wild. Luckily, nobody at Bridgepoint Hospital ever contracted SARS. Nobody died from it there. And it was just something to live through. It really was. It was a time. It was scary. So I understand why people are upset and worried and nervous about this new coronavirus, and they're trying to like stock up on face masks and stuff like that. I'm just trying to point out some of the things that maybe you don't know that go along with it. They're not comfortable to wear. You're not supposed to touch them. You need to learn how to put them on and take them off. Those are important things. And so now let's just talk about the Gwyneth Paltrow selfie. Oh my gosh, goop with her goopiness. I mean, I'll put a picture up here of the selfie that I'm referring to if you haven't seen it. She is taking a plane ride to Paris, according to her caption, and she's just like, oh, she's been in the movie about a pandemic, so she's already lived through it. What I'm seeing with this that concerned me when I looked at it, and when I say concerned, irritated really is probably the correct word, is that first of all, she's using a reusable face mask. I don't know if she got this fitted or not, as I've been saying. Maybe she did, maybe she didn't. I don't know. Let's just say she did for argument's sake. I'm just saying in general, they're supposed to be fitted for you really to get the benefit out of them. I think that a mask like this, you know, I'm again, not a professional respirator fitter. I am not a public health official. I don't work in occupational health and safety, but just going from my experience, I am wondering why she's wearing a reusable mask. You know, maybe that's supposed to be better for the environment, but here's the thing. When she takes it off, what is she gonna do with that mask? Because you're supposed to dispose them. If they have germs on the front of them, you don't want that touching your belongings. You don't want to get that on your hands. You do not want to be stuffing that in your purse. I mean, maybe she had an assistant right next to her and it became her assistant's problem and the assistant dropped it in a Ziploc bag and sealed it. I don't know. Did she clean it properly after? Questions? We don't know, but very often you'll see people are not crazy about these reusable ones, probably for some of those reasons. The other thing that I saw that I was like, Gwyneth, was that she's wearing an eye mask, right? We see that she's about to have her little nap because, as we know, as Gwyneth, she's in Paris, she's flying to Paris. It's a long flight. I'm sure she's in first class and her seat reclines and she's gonna take a nice nap. But here's the thing, if you're wearing your face mask, you do not want to be like touching your face. And it is hard to put one of those on without touching your face at all. These are glasses, which you can hold by the stem, but those are like, there's like this elastic bit. As we know, you're not supposed to touch your face. Don't touch your face. That's really important. Wash your hands a lot, but also don't touch your face. When you touch your face, that's one of the ways that germs can enter, and you know, it's one of the reasons that protective gear in a hospital scenario usually involves eye covering as well, because that is an entry point for germs. So if you're going up and down with your eye mask, that's probably not a great idea. Maybe she's getting her assistant to do it for her. Listen, I don't know Gwyneth's life, but I'm just saying that send a kind of confusing message. Like, sure, she's wearing a face mask, but it's a reusable one. And also she's got an eye mask. Well, how's she gonna get that on and off her eyes? I'm guessing that, you know, she probably doesn't have impeccably clean hands. Maybe she just hand sanitized herself. I don't know. I'm just saying, was this really the message that we needed right now? I'm thinking maybe not so much. If it were me, I would not touch my eyes. If it were me, I would use a disposable face mask and make sure that it fitted me properly before I went onto Instagram, because, you know, she's an influencer. She has, I don't know, 6 million people following her. That's more than the entire population of Ireland. So, you know, I just have a greater issue with that as well, which I'm not gonna get into right now. I just wanna make sure that you guys know what I have to say on the situation, just based on my own experience, and just know that those proper face mask is not a comfortable thing, and that you definitely need to learn how to wash your hands, take it off properly, wash your hands again, dispose of it, all those things. I'm not even saying that that's the order that you're, like, learn the order. Don't rely on your memory also. Like, you should get a checklist. You know, use a checklist to make sure you're putting it on and taking it off hygienically and properly, so that you're actually using it for a good reason. Otherwise, what's the point? If you're just gonna touch the front of it and get those germs all over your fingers and then touch a whole bunch of things, you just maybe even made it worse. That's what some healthcare and public health officials are saying. Like, sometimes those face masks, if you're not using them properly, can make it worse. So I am not the be all and end all of knowledge about this. I will put down some links below so you can learn more from, like, actual good sources, right? Do not get your healthcare information from Gwyneth Paltrow or even from me. Just saying, educate yourselves. All right, everybody, thanks so much for watching. Hope you're all well. Remember to like and subscribe. Bye.